Then we consider about what are the new things in low vision. We are clinicians, we are interested in knowing about new stuff which is coming up. And these are 2x magnifying contact lenses which have been developed by the US military, and this is an experimental military project only at the moment. They are these scleral contact lenses which have these diffraction rings all around them and a central hole. And these have to be used with a polarizing glass, as you can see in the bottom picture. So what happens is that when light goes through the central hole, that's the normal path, and the patient's vision is normal like we see. But once you put the polarizing glass in front of the contact lens, then the pathway of light is changed and it goes through the periphery where it is diffracted internally and gives a magnification of 2.8x. Orcam is a device produced by an Israeli company. It merges artificial intelligence with augmented reality, and it's a very small little device which can be mounted on a spectacle frame. And it reads menus for patients, it reads books for patients, and it identifies faces and tells you who is approaching you. That is Dr. Vivek who's coming to see you now, or that is Dr. Ali. And it's got a very tiny speaker which is quite close to the ear, and it tells you and reads to you things from books, or tells you who's coming to see you when you point that camera or your spectacles or turn your head towards the person who's approaching you. Then this is an implantable miniature telescope. This is about 22 years old, but the only reason why I mention it here is because it is not used very commonly. And it is a very thick device, as you can see, and nowadays more or less it has been abandoned in favor. People are still doing it actually, and it provides 2.2x magnification, but it has been replaced by other devices like this one. This is called the Lipschitz mirror implant, which produces 2.5x magnification, and it uses the principle of the Cassegrain telescope. There's a tiny mirror in the implant, and that mirror magnifies the images. The beauty of this implant is that it is more or less like a regular implant. All right. So in the center, when the rays go through the center hole, that produces the magnification. And the periphery of the lens is used for peripheral viewing, so that the patient can have bilateral implants and he can use his normal vision for navigating in the streets. Whereas wherever he wants to look at a magnified image, he just has to focus through the central hole. And this is an advantage over the previous implantable telescope, because there you have to use only one eye for magnification and the other eye has to be normal for peripheral vision. Okay, we're going to skip this slide, and then this is the new one which has come about 2 or 3 years ago. This is the Scharioth Macula lens, and it is a foldable implant in contrast to the other implants which were solid implants. And this is used as a secondary implant to be implanted in the sulcus, and it has got a central optic zone which is of +10 diopters, and it provides magnification for near. The rest of the implant is used for peripheral viewing. So this is a secondary IOL which is new. The other thing which is new, actually 4, 5, 6 years old, is the Bionic eye, which is produced by Humayun Group in America, and commercially it is known as the Argus 2 Epiretinal implant. There's an Epiretinal implant, as you can see over there, and it is implanted in the retina, connected to a ring which is actually the receiver, and the transmitter is mounted on a spectacle and transmits the messages wirelessly to the implant. Now, a lot of studies have been done in 2012 and 13 in which people have identified 9mm high letters at 30 centimeters, and some of them could also could read unrehearsed words. So it's pretty successful commercially, and it has been available for the last 7, 8 years. Now they're working on another model for a few years, which is called the Argus 3. And the idea in the Argus 3 implant is to improve the perception or visual perception to recognizing faces. In Argus 2, you can only see a pixelated image, but facial recognition will be possible in the Argus 3. I don't know where it's going to come. They advertised it 2 years ago that is going to come soon, but so far they haven't launched it in the market. Now this group has produced an artificial retina from stem cells, pluripotent stem cells. They've used it from human beings, and they have induced them to transform them into photoreceptors. And they have actually succeeded in producing the whole optic cup with all the 10 layers of the retina with light sensitive photoreceptors. So let us see where it takes us. In the next few years, we'll know if artificial retina will become an actual reality or will remain a myth. Now, this is an artificial retina device produced by a Japanese team, which works very differently from the Argus 2 device that we mentioned, because here there is a solid electrolyte medium which is implanted, the blue thing you see, the blue platform you see at the bottom picture. And over it there is an overlay of conductors which are microchannels in which lithium ions move. So when light is presented to this implant, then lithium ions work in these channels in such a way to mimic the neurotransmitters found in the retina, and they send a voltage to the neurons, the ganglion cells, and that produces the image in the eye, as you can see on the right hand side. And this is better image than the Argus 2 implant, they say, because it gives a lot of contrast, which is usually not seen with the Argus 2, which is only basically visualizing of phosphenes. Another new thing is Optogenetics. This is another team which presented its findings in Nature Medicine in July 2021. They've got very limited persons in trial, 3 or 4 persons only, and 1 completed the trial. So it's very early to say it, but it sounds very nice, because what they do is that they have a gene which encodes for rhodopsin, and it is introduced in the retina by a modified avian adenovirus, and it implants into the retinal ganglion cells. So even if the photoreceptors are damaged and are not working, you use the retinal ganglion cells as photoreceptors. And then what it does is that there is a pair of goggles that one wears, which are known as biomimetic goggles, because rhodopsin, as you know, is not sensitive to all the colors of light. So they use a very special wavelength. They have not disclosed what wavelength. So the camera picks up the image and converts it into that specific wavelength and beams it on the retina. And the retinal ganglion cells then create an image. They actually create an image. And one person who completed the program in the COVID times was a lady whose vision improved from perception of light to recognizing letters and objects placed on the table, which they concluded was a 57% improvement in vision. So optogenetics holds the key for good vision in the future. And so, ladies and gentlemen, so far as low vision is concerned, we are progressing towards what Mr. Schwarzenegger portrayed in his iconic films, a cyborg. We are not there, but we are going to get there pretty soon.